my name is Dr. Stephanie Graff at Brown University. I'm here to offer you a quick OncoAlert ASCO23 update. One of the big breast cancer presentations that we'll see this year is the NATALEE trial. NATALEE, we already know, has met its primary endpoint based on the press release of invasive disease-free survival. We're waiting for the presentation by Dr. Dennis Slayman, late-breaking abstract number 500. NATALEE was ribociclib and endocrine therapy as adjuvant treatment for patients with hormone receptor-positive early-stage breast cancer. I think as medical oncologists in practice, we will grapple with how to choose between the MonarchE population and the NATALEE population. And so it's important that we spend time continually reviewing the two trials and making comparisons between the two of them so that we can get comfortable on which treatments might be appropriate for which populations. First, in the MonarchE trial, we see that 5,637 patients were randomized between aromatase inhibitors, tamoxifen, plus or minus ovarian function suppression. About 30% of the patients received tamoxifen. They received abemaciclib at 150 milligrams twice a day, the dose we use in the metastatic setting, for 2 years of therapy. Conversely, in the NATALEE trial, 5,101 patients were randomized to an aromatase inhibitor plus or minus ovarian function suppression, no tamoxifen because of the drug interaction. Patients were randomized to receive ribociclib at 400 milligrams once daily, slightly lower than the starting dose in the metastatic setting, and they took the drug for 3 years of therapy. We can also see that there's differences in the populations. MonarchE had a slightly higher risk population when you consider anatomic stage. MonarchE did not accrue a population with lymph node negative breast cancer and had some eligibility boundaries around lymph node, low volume lymph node disease, where most patients with N1 disease were only eligible if they had other risk factors, like a large primary tumor size, grade 3 tumor, or a Ki-67 of greater than 20%. Conversely, in the NATALEE trial, patients with N1 disease were eligible. Additionally, patients with T2N0 disease were also eligible if they had a grade 3 tumor or a grade 2 tumor with either a high Ki-67 or a high genomic score like Oncotype or MammaPrint. We already know that the NATALEE trial has been announced to have a phase 3B trial planned called WIDER to cast that wider expansion and try to continue to expand on the data collected from NATALEE. So we look forward to that continuing effort as we wait to hear whether or not there will be an approval for the NATALEE trial combo, and as we continue to find strategies to use these medications in clinical practice. Other early stage hormone receptor positive abstracts at ASCO23 of interest. Abstract number 503 was a meta-analysis of 15,000 patients and looked at the effects of ovarian ablation or suppression on premenopausal patients. And we saw that ovarian function suppression reduced the 15-year risk of death with an improvement of 8%. Notably, it did not differ significantly by tumor characteristics, telling us that the number one predictor was age and that patients benefited from ovarian function suppression. Next, poster number 376 looked at the influence of the time of day that patients took their hormonal therapy on their outcome. And interestingly, for tamoxifen, the DFS was prolonged for patients taking tamoxifen in the evening or night as opposed to in the morning, with a hazard ratio of 0.43. Lastly, poster number 372 looked at the real-world outcomes of patients using adjuvant non-steroidal aromatase inhibitors as compared to tamoxifen for a population similar to NATALEE, and saw that among patients with stage 2 and stage 3 hormone receptor positive breast cancer, non-steroidal aromatase inhibitors improved invasive disease-free survival by 17% with a similar reduction in DDFS as well as compared to tamoxifen. Taken all together, I think we continue to expand our knowledge about how to optimally utilize hormonal-based therapy for the adjuvant treatment of hormone receptor positive early stage breast cancer. Thank you.